Welcome back, and I hope you've all had a refreshing break. It's my pleasure to introduce the next session, which has the title AI Club 10 Use Cases for AI in Healthcare Today. But before I hand over to and introduce Rachel Dunscombe, a couple of points. This morning, when Carolina was giving her introduction, she referenced the AI Club that we have created. And I thought that it would be helpful by way of some background to explain how we have got involved in AI in healthcare. As part of our roundtable program, we were looking at the development of the European health data space. And some of our multi-stakeholder experts, in one of their meetings when they were looking at digital health infrastructure, started to talk about AI. And we realized that they needed a forum, or in fact, they asked for a forum in which they could talk about some of the challenges and possible solutions that they were encountering and needing in their day-to-day work. So these were both academics, regulators, industry experts, and we facilitated that need by creating the AI Club. And it's now completed its first year and will shortly publish its first report. But I think that whoever you are or wherever you are in the world, it would be hard not to have seen the amount of publicity that AI has attracted in the last 6 months. And in particular, generative AI, much of which some people might describe as hype or describe as very concerning about people losing their jobs and that systems would be unsafe and endanger, let's say, patients. In our AI Club, there was an agreement that we needed some balance around AI, and in particular, AI in healthcare. In that, radiology has been using AI for some considerable period of time and doing so very safely. So the idea of this session was born to try and provide that balance in terms of explaining use cases for AI in healthcare. And that's exactly what Rachel will now do. So by way of introduction, Rachel was one of the best CIOs in an NHS hospital. She's the former CEO of the NHS Digital Academy. And she's worked with the ClassArch Collaborative. She is now the CEO of OpenEHR, as well as being a director of the Digital Health Society. And she leads our AI Club. So on that basis, she is eminently qualified to start to discuss the 10 use cases for AI. And then finally, she's also a visiting professor at Imperial College and a member of the UK government's AI Council. So without further ado, I will hand over to Rachel. Thank you.
Hello, I'm Rachel Dunscombe and I'm CEO of OpenAIR and visiting professor at Imperial College London. I'd like to talk to you today about use cases for AI and also about the AI Club, which has been an initiative of the Digital Health Society. First slide. The Digital Health Society worked through 2022 and 23 to form something called the AI Club, which produced a report on AI in healthcare. And the group was formed of experts, policymakers, those from industry, life sciences, and health systems. And they produced a paper, which actually informs the system about the current state of the landscape, but also the challenges that are, being faced within health and care around AI. The group examined 4 different areas. So the first theme was use cases and evaluation of healthcare AI. The second was AI explainability for citizens. The third was AI competencies and education in healthcare. And the fourth was safety and bias in healthcare. And great thanks to the leads, Professor Deepak Kalra, Dr. Catherine Cresswell, Dr. Mehdi Khaled, and Sarah Boltman for actually taking lead on those themes. Next slide. The report itself actually came out with 6 recommendations, and it found that we need a global framework for evidence-based impact and process evaluation for AI. But it also needs us to be able to create global comparisons and allow for continuous monitoring of real-world deployments. The second recommendation was creation of a global evidence-based framework for risk and opportunity. So this looks at, the risks of using AI, but also the opportunities and benefits that we get. And this needs to include sensitivities such as local demographics, healthcare priorities within countries or nations, and personalization, including ethics. The third recommendation was around the explainability of AI. So it needs to meet the stakeholders' needs, be it the citizen, be it professionals. And it also needs to address the sort of needs of leaders, such as policymakers. So that recommendation is really about much wider explainability for the whole system. The fourth recommendation is about evidence-based competency frameworks and skills. So this is for the health and care workforce, as well as the sort of people working in and around the care sector. And we need to make sure that we have educational offers that will allow the system to, reach that level of maturity that we need in order to use these tools. The fifth recommendation is to have a global exemplar literacy framework for our citizens. So how do we get citizens to feel confident using AI and the outputs of AI and understand how it's being used as part of their healthcare journey? So actually creating that is something that needs to happen so that we have equity amongst citizens and that they're able to, work with these services and feel confident in them. The final recommendation was around a transparency framework for data. And we need to ensure that training data is fit for purpose, continues to be fit for purpose, and can be benchmarked globally and mitigates bias. This is something that we still haven't seen, standards emerge around. And so these 6 recommendations are really the things that we believe we need to do next. As you can probably see, most of them are global recommendations. And all of these recommendations, along with the rich narrative, is going to be produced by the Digital Health Society and the ECH Alliance in a report that will be published soon. But that then relates to the 10 use cases that I'm going to present to you today. So the 10 use cases are very much examples of how AI is being used today in healthcare. And some of these have actually come from the work that we did on the report. Some have come from my personal experience. But it's very important that we understand some of the different directions that AI can actually take. Next slide. So the first use case that I'd like to talk about is finding connections between information. Now, within health systems, we can use insights to have sort of light bulb moments, if you like. I'll give you one example. Working within AI, I did a piece of research that found that people with Crohn's disease can actually find out that they're going to have a flare-up or an issue earlier if they actually monitor their stride length using devices. And finding these sorts of patterns and pathways allows you to give earlier intervention and prevention to exacerbation of conditions. That's just one example. There are many thousands, if not hundreds of thousands of other examples out there that we wouldn't know about until we're able to analyze correlations in data. Now, patterns in patients' health records could indicate the likely success of treatments or surgery and so on. If you look back at other people that have had successful surgeries and seen what attributes they have, and finding those sorts of correlations in data, AI, especially with generative AI, is becoming very good at. And so one example I wanted to give you was defining thresholds for intervention for frail patients. So using AI to actually find patterns of success for keeping frail patients independent, and what the interventions were at what point and the ideal point to intervene. So that's something that I think is really interesting to think about, because computers can look at commonalities in ways they never could before with these sorts of generative AI technologies. Next slide. The next sort of use case is around creating insights from big data. And health and care is very information rich, but insight poor. And the arrival of generative AI, we have the ability to use technology to drive insights from our data, and far more insights than humans could generate by looking at how data relates to each other. So, we may be asking AI to find correlations between diseases or clusters of disease in geographies, or informing us of the best placement of new services. Asking generative AI to assess the cause and effect within a population data set allows health systems to decide where to invest. So some of the examples that I've been involved with have actually been around healthcare planning. And a real world use case here is around analysing gum services, gum clinics, and working out where the optimal placement and opening of hours of those would be for the population based on the patterns of need and the patterns of usage. And that's really where I'm seeing AI assist with healthcare planning, so the planning of services and planning how they're provisioned as well. Next slide. So personalizing content is a big piece of the picture. And we have, citizens that we need to engage with. We need to speak their language. We need to place the experience of healthcare in the context that is right for them. And we have to enable self-care and self-management. If you think of generative AI, which we've all heard a lot about, so things like ChatGPT, they are really hugely powerful personalization engines if used correctly. And while you may hear that, these things hallucinate, if trained correctly, they will use what they're really good at, which is personalizing, and then use the factual information as factual information. I've seen some very good examples of how generative AI has been trained well. So what we need here is that information is presented in the best way to the patient. It can provide the advice in a very simple way. For instance, if it's a child, it can do it in language that's appropriate for pediatrics. It can drive it by voice if needed, or it can drive it in different ways that are appropriate for the patient to make it more accessible. And here, I'll give you a really good use case that I've worked on. And this is generative AI driven multi-language recipes for, cultural context of pre-diabetics. So if you happen to be, somebody from a single person household, it provide recipes for you in your language with one, person portion sizes. If you're somebody that comes from, say, a community from a Pakistani background and you've got a larger household, it will recommend, in the language of your choice, culturally, appropriate recipes for, the larger household size. And those sorts of things are really, important, because what we quite often find is that those people that don't have English as a first language, or, who vary in various contexts from, the sort of cultural needs of our dietetic services, don't necessarily find recipes that applicable, because certainly our Polish population probably don't want to eat, the English recipes, and and our Gujarati population don't want to eat, fish and potatoes. So it's really about giving people a service they need in their cultural context. Next slide. So finding opportunities to improve quality. So the quality that a healthcare system delivers is not just the statistics of their outcomes, right? It's about their baseline, about their demographics, their population, the social determinants of health, existing disease burdens, and then how they perform with that sort of baseline. And they're very, very complex factors. And those factors make benchmarking difficult across all the different facets of healthcare, across those population, differences. And it can be very hard to compare between geographies. It can be something that we can't do easily, with our traditional information sort of models. But actually being able to use AI to look at the real world quality on top of your baseline and finding comparative benchmarks. So other people for certain services who've got similar demographics and populations to you really allows you to see your true real world quality and where you've got opportunities to improve, but you may have opportunities to celebrate success because you're doing well, you're providing good quality. A real world use case here is identifying outlier cardiac outcomes in real world context. So it's about actually finding out that a certain population is, not having potentially the right outcomes, and that you've got an opportunity to improve that, but identified by AI, where it's able to say, for your baseline for this patient group, you have an opportunity to improve, and then putting in place quality improvement initiatives. I think it's really important because we have a lot of quality improvement initiatives within healthcare, but from my experience, quite often they're really just finger in the air. Should we do an improvement, sort of sprint here, or should we, do some improvement work, say, in a nominal area? But this helps us provide a much more scientific approach to truly telling us where the opportunities are to improve. Next slide. So the next slide is about really the human experience and the human interface. And we did talk a little bit earlier about personalization, but actually this use case is around providing an accessibility to large bodies of knowledge. So in many cases, both for clinicians and citizens, it's hard to navigate, it's hard to search, it's hard to interpret. And they're often only provided in one language. So again, if you speak, sort of a non-English language as your native language, it can be hard to actually use. And we also have, a need for people to be able to understand the care they're receiving, or the advice they're getting, or the services that they are entitled to access. But large language models that are trained on this data can enable those facts and those knowledge bases to actually be accessed via multiple languages and via various different interfaces that allow you to do a sort of question and answer based interface. And there's a really lovely example that I've actually got hands-on with, which is in a European city, and is using a multi-language ChatGPT-like interface to health entitlements at a city level. So what help and support are you entitled to? What services can you access? And, having tried it with different languages and having tried it with, different chat styles, it was absolutely fantastic to see how it was actually surfacing information correctly, but also pulling together information from disparate sources and knowledge bases to give people a really good sense of things that they could access or use. Next slide. So, finding cohorts in big data. I think the sort of panacea for much of what we are doing with precision health and personalized medicine is to find out the attributes of people that have a disease or may develop a disease. And rare diseases are a classic example of this, where there are early signatures in people's health records that indicate they may be part of a cohort for a disease. And some of the examples I've seen are issues like childhood symptoms without a cause, repeat diagnostics with no conclusive result, and potentially other things like correlated conditions within the record that may not have been picked up on. So this data often forms an early signature for disease before it's suspected. And within the longitudinal health record, these patterns really can be found far earlier with AI, and AI can find those patterns as well. So they can tell you for a cohort, there may be a 40% likelihood that somebody who's going to develop this disease will have gone in for a certain diagnostic, but not had a conclusive result, and so on. And again, I've been very lucky to be close to one of the real world use cases here in rare diseases. And this use case was about cohort identification for pediatric diagnostic records. So it took the diagnostic record of the patient and their letters. It looked at what was happening within that childhood period. And it identified that if certain things happened 2 or 3 times within, a pediatric record, that there was a high chance that that individual would have a certain rare disease. And that has helped people to build up cohorts, which will then be used once they're validated as registries in a way that's not been done before. So finding themes in big data. I think we quite often think about AI as perhaps being clinical. We hear a lot about clinical use cases, but it can actually help how organizations are governed. And actually one of the ways that you can innovate is governance innovation. And I've become very interested in this. AI can look at themes in big data to support your risk management, for instance. It can look at, trends which may be becoming risks and highlight those to you. It can look at trends in clinical outcomes to show you patterns that you may want to, look at in your clinical governance. And it can support, clinical quality and summarize data for corporate use as well. Generative AI, I've used generative AI to write summaries for me in what I'd call a house style. So I've fed generative AI a number of papers from a healthcare system, and I've said, and now please write the summary of this in the style of the previous sort of reports. And that means that really you're keeping consistency as well for health systems who report in a certain way or expect, their data to be presented to the board in a certain way. So a real world use case here is to help create standardized board papers from previous month's activity. So this is something that I've seen an organization start to use, and what they're doing is using generative AI to standardize text coming in from different places, so it's in the right format and reads consistently. But it's also looking over information sources from the previous month to see if there are any highlights that need to be brought forward to the board as well. Next slide. The next one's quite an interesting one, and I've had the privilege of working with a couple of companies in this space just briefly. It's around creating personalized avatars, and healthcare is increasingly including patient-facing services and experiences. We want to be personalized, and we want to make sure that people feel confident with the clinician and that they have a relationship with the clinical team under whose care they are. And what is lovely about the avatars that I've been involved with, one in particular, which is from a company based in India, is that it can speak multiple languages, You can use the clinician's likeness to actually present in whatever language. And you can actually potentially, as a clinician, just put a couple of notes in and it will render a video or an avatar video that can be sent to the, to the patient. And this is allowing clinicians to, really reach out to the patients and give them a personalized service, but without the overhead of having to call them or ring them or see them face to face. So real world use case with that, fantastic company that I talked about in India is an avatar clinician providing after appointment guidance and summarizing advice. So basically, the advice leaflet is summarized, the outcome of the appointment is summarized, that's rendered via the tools into an avatar video, and that is then actually sent to the patient's portal so that they can actually view that. And the nice thing is that they can go back to that time and time again, but that could be in any one of a number of languages. So again, if English isn't your first language, it may be in French, it may be in German, it may be in Urdu, it may be in any one of a number of languages that are appropriate, which means it's more digestible and understandable to you. So these personas, I think, have got a real place in bridging language gaps, but also giving that personalized service. Next slide. So creating synthetic data. Synthetic data is something that not everyone knows a huge amount about, but is actually a really big growing field. So it's data that behaves like real world data, but it doesn't have any real people in it or real personal data. It can be used for research, to test concepts, to train AI, to test hypotheses, and to ensure privacy, such as in academic research. Generative AI can be used to help generate synthetic data for healthcare, and it improves insights while ensuring privacy. So this really means a data set that statistically behaves like the real data, but doesn't include your name, my name, or anybody else's name. And a real world use case here is creating synthetic data for soft validation of cohorts with life sciences research. And this is something I've been involved with. What this does is to create a set of data with the same attributes as a real population, but with no real people in, for a life sciences company to say, yes, there are enough patients here with the right attributes for us to look at doing a research trial. So it's quite a nice way of maintaining privacy, but getting value quickly. Next slide. The final one is something that we've heard a lot about in the media. So creating code for automation. And generative AI is being used to create code in healthcare. And that may be for automations in terms of, scripts that can process things. It may be robotic process automations, so things that transpose across systems. It may be within communication and office tools. And a really nice use case here is coming from one of the major vendors of productivity tools. And they've just launched generative AI in their office productivity, which allows information to be easier to find and also be acted upon. So everyone really will be seeing these sorts of things happening now on their desktop and will have an ability to access these tools. Excuse me. So finally, final slide. I just wanted to thank you really for looking through these use cases. We are now in the cognitive age, so we're seeing all of these use cases starting to be explored. We are working out how we leverage them for human good, and we need to govern them well, because these are complex environments where, as I said at the beginning around the AI Club, we need to understand opportunity and risk. We need to balance those. But the one thing that I would like to say is this is everybody's job to get involved. We need to engage everyone within our health systems, and as I said earlier, our citizens too. And so I would really welcome you, joining the much wider community that we have and the initiatives from Digital Health Society and the ECH Alliance around forwarding this so that we can actually get the governance that we need globally to make sure that this is scalable. One final point from me, if you like the images here within the presentation, all of them were generated with generative AI. So for me, it's something I'm using day by day to create and enhance presentations and convey messages. I hope you enjoyed it. Thank you.